Chapter 20, Immunologic Emergencies. When we refer to immunologic emergencies, that's just really the $5 word for saying allergic reactions and allergy-related emergencies, because the immunologic emergencies are those that occur because the body is attacking something that has been introduced by whatever means necessary. You must be able to recognize the life-threatening complications associated with allergic reactions and understand what is a normal response and what is that life-threatening response. So let's look at the anatomy and physiology of the immune system. The immune system, of course, is designed to protect the body from foreign substances. So it is designed to recognize the substances that are not supposed to be in the body, that are a negative, and initiate a series of responses designed to protect the person from that invader and to make it inactive in the body. An allergic reaction is what we get when the immune system has an exaggerated response to the substance. So while we might have that outside stimulus, pollen or bee sting or food, the reaction is more so because of how the body is reacting to that stimulus, not because of the stimulus itself. So some of the things that we see happen are the release of chemicals designed to combat that stimulus, that external stimulus. And that includes the histamines and the leukotrienes within the body, the goal being to break down that outside stimulus so that it doesn't do any harm. We may not necessarily always know what is causing our reaction, especially if we've never been diagnosed as having an allergy to something before. We recognize the signs and symptoms, whether they're minor or severe, and maintain a high index of suspicion for whatever it was that we most immediately put into our body or allowed to our body to respond to. Allergic reactions may be mild and have a very local impact, such as poison ivy or even light hay fever or sinus, seasonal allergy type stuff. But the ones we're most worried about are going to be those severe and systemic, the whole body reaction to an external stimulus. So this kind of gives you that idea of what is happening in the body and what happens to each of the body systems as a result of the introduction of the external stimulus that causes that life-threatening reaction. So when we're talking about an extreme and life-threatening allergic reaction, we're actually talking about anaphylaxis. And anaphylaxis will impact not just the lungs, but the heart, the blood vessels, and the skin. And as a result of that external stimulus that causes anaphylaxis, we actually have a patient who will likely go into shock and potentially face death without appropriate treatment. We're used to some of the signs and symptoms, and they're things that we tend to gravitate towards seeing when we think of anaphylaxis. And the first is hives or urticaria. And you can see in the picture on your screen an example of urticaria. Kind of across the board, you've got the massive raised bumps that we think, but then if you look towards his upper, actually both right and left side, you can kind of see the smaller red bumps that are occurring. So this is kind of that full body reaction to an external stimulus. So those are hives. The next common one, and this poor lady is giving us an extreme example, is angioedema, so swelling of localized areas. And my guess is that this lady probably experienced ingested allergen, so she probably ate whatever it was that is causing this reaction. So you've got the edema in the tongue, and you can also see around her eyes the swelling that's happening there. So that angioedema is our second common sign. And then the third is wheezing, that high pitch, and it's on expiration because we can take our breath in, but the mucus that is building up as a result of this reaction is causing it harder to exhale. So you might have a and kind of a whistle or a screech as they breathe out. You're going to also likely see in a severe anaphylaxis patient hypotension, because that allergic reaction actually causes vasodilation. That's where, and that increased capillary permeability is where we're getting some of the edema as well. And then because of the reaction, you're also going to have a patient who maybe complains of nausea and vomiting and even abdominal cramps, especially in your ingested allergens. So if somebody eats something they're allergic to, as we've talked about in other chapters, when the body recognizes that there is something inside that isn't supposed to be there, it's going to try to get rid of it as much as possible in any way possible. So what are some of the common allergens? Well, the first is food. Shellfish and nuts being very common allergens that we see nowadays. The thing with that is it could take up to 30 minutes for that allergic reaction to appear, because the body has to break it down and absorb it and then recognize that allergen. And then you've got medications like penicillin, morphine, codeine, allergens to some of the anti-inflammatory drugs. And these are not necessarily going to, again, appear immediately based on how the drug is administered. If I take a drug orally, then yeah, it might take a little bit. But it really just depends on the person and the number of times they've been exposed. This shows you again that immediate reaction, the hives and the breakout. When it is an injected medication, that's when you're probably going to see that more immediate reaction and more severe reaction, because it immediately goes into the bloodstream, versus that oral medication that takes time to digest and absorb into the bloodstream. Some other allergens, we've got plants. So dust and pollen, ragweed, maple, oak, trees, basically nature. And then there are people who will have allergic reactions to chemicals, especially seen in healthcare providers is a buildup of allergic reactions to latex. And that's why we've seen nitrile gloves really take that forefront. But there are people who will have reactions to chemicals and soap, to laundry detergent, perfumes, all sorts of things. And then you also have people who have allergic reactions to insect bites and stings. And it's not the sting itself, it's actually the venom that is inside that stinger that the reaction is causing the reaction. And that may lead to either a localized reaction right there at the site of the sting, or it can also lead to a more systemic reaction as the allergen and the venom is absorbed into the body. Approximately 3% of adults and 1% of children are allergic to the venom of bees and wasps and hornets. And so we've got to be cautious, especially in this time of year as we go into the summer, to see an increase in that. And allergic reactions are quite an issue. They have caused up to 50 deaths per year in the United States. The stinging organ is a hollow spine that projects from the abdomen of the insect. And this spine then injects venom directly into the victim, which then, depending on how much, can impact what the reaction is. So, honeybees cannot withdraw their stinger. When a honeybee stings you, if they do, they will fly away and die. The problem that we have is more with the wasps and the hornets, who are able to withdraw their stinger and sting an individual multiple times. One of the other problems we have are fire ants or other ants who bite repeatedly, injecting their toxin at the bite sites. So the picture on the left are fire ants, and then the picture on the right shows you what the bite sites look like when they occur. The problem is not just a single fire ant bite. It's when you get into a fire ant hill or venomous ant hill, and all of them start to attack. So some of the signs and symptoms associated with insect stings include a sudden pain in a specific area, swelling, and like a small whelp or raised area. As they develop the reaction, you'll start to see an increase in the hives, the urticaria, redness in some of our light-skinned patients, and then itching, and that what they call the wheal, or I call it the whelp. Again, it doesn't necessarily need to be that they were outside. It doesn't need to be that they remember seeing that stinging insect, but that sudden sharp pain and then having that raised whelp. And oftentimes, if it's a large enough stinger, if they've left the stinger, you'll see it, but if the stinger has fallen out, you may see a center hole where the stinger was. Ice can sometimes help, especially if the swelling is significant. If it's just a localized area, it's not going to be that serious. So if it stays within the area of the sting and there's no other signs and symptoms in other parts of the body, then you're probably looking at a very localized manifestation of the injection. When you've got a patient who is having anaphylactic reaction to the sting, you will start to see them increase in their signs and symptoms. So their respiratory system is going to begin to become impacted. As the bronchi begin to constrict, you will have bronchospasms and wheezing, chest tightness and coughing and difficulty breathing, increased anxiety, gastrointestinal complaints, and then low blood pressure as you get increased vasodilation. When the patient continues to go untreated, they will go into respiratory failure, and if it is not recognized and treated in time, this will lead to the patient to go into respiratory arrest and then death. So what do we do for these patients that are in an immunologic emergency? Well, the first is seeing size up. Where are they? What are they doing? Is the scene safe? Especially in an environment where you're looking at a sting or an insect, you want to consider whether or not you are going to be in danger, which, of course, if you're allergic to, that's an issue. But are they in the area of whatever it was that is causing the reaction? So, they're in a restaurant where peanuts were being served and they've got a severe allergy, or whatever it is. Let's see if you can see what may be that source, and let's also remove them from that source of the reaction. Traumatic injury could be present. An injection, a sting is a traumatic injury, very low, but it is a break in the skin. So, you do have to consider treating that area. Always remember to put your PPE on, and then consider the need for additional support with ALS, especially if this is a severe respiratory distress patient when you arrive. Quickly identify any immediate and potential life threats, and then get that general impression. Do they appear to be visibly distressed? Is this an end of the situation? Allergic reaction, or are you early on and they're just very uncomfortable at this point? Once we've done our scene size up and we've formed our general impression and we've ensured the patient's mental status, we move on to airway and breathing. Anaphylaxis and severe allergic reactions will cause problems with the airway and the respiratory system. And you have to keep that in mind, because if you come across a patient who is already experiencing edema in their tongue and swelling in their airway, it's only a matter of time before that airway completely constricts. And once it's completely constricted, the only way to open the airway is two options: giving the drugs that we can give and hoping for success, or performing a surgical airway, which we can't do as BLS providers. You've got to quickly assess for that work of breathing, for the use of accessory muscles. Are they tripoding, nasal flaring? Is there obvious signs of difficulty breathing? Consider putting them into a Fowler's position, so semi-reclined. provide high flow oxygen and use the bag valve mask as necessary. And be prepared to have to suction. And, if there are already signs of shock, put them in a supine position. Once you have assessed and treated airway and breathing problems, move on to circulation. Remember that this patient may present with hypotension, which at the circulation you may not know yet because you aren't taking a blood pressure, but you are going to see that rapid pulse rate or the cool, pale skin, maybe even red, moist skin, delay in a capillary refill because of the vasodilation. You also need to consider that this is a good time to be looking for hives or the site of the sting if that's what they think it was. We need to give oxygen quickly. We need to get them that supplemental oxygen, considering a nasal airway if we can. We need to consider that this is a type of shock, and so we need to prevent loss of body heat and put them in an appropriate patient position. The definitive treatment for anaphylactic shock is epinephrine. Unfortunately, we're not at a point where an EMTB can give non-prescribed epi. So right now, it's still that your patient has to have a prescription and must have their EpiPen with them. Always provide transport promptly. So any patient who is in an allergic reaction, anaphylaxis, so that life-threatening level, should be given immediate high priority transport. Bring all of the medications and be prepared for them to crash pretty quick. If that patient is only in the early stages and not necessarily exhibiting those life-threatening symptoms, you can stay on the scene to continue assessment, but in reality, because that patient can get worse quickly, I'd still treat them as a high priority.